Welcome to the latest New Local podcast, where we'll be discussing an ambitious programme to tackle health inequalities and improve population health in North East Sheffield. I'm Alistair Ross, the Senior Practice and Research Lead at New Local. Our organisation has been supporting this project since 2023, and we're delighted to talk with the programme's leaders about what's worked, what lessons have been learned, and how they've negotiated the challenges of getting a new model of public service delivery up on its feet. New Local is an independent think tank and membership network of councils across the UK. I'm part of the practice team that supports our members and other partners to deliver community-powered public services. Our team helps get good ideas up on their feet. With me today are 5 guests who've all played a key role in shaping this project called the North East Neighbourhood Model. The programme aims to reduce health inequalities and improve population health in 4 North East neighbourhoods of Sheffield and has been running for 2 years. It was conceived and is funded by the NHS South Yorkshire Integrated Care Board, or the ICB. Joining us are 4 community leaders: Abdul Shaif, CEO of Aspiring Communities Together; Gulnaz Hussain, CEO of Fir Vale Community Hub; Megan Ori, Partnership Manager at SOAR Community; and Sophia Seed, founder of Reach Up Youth and Lord Mayor of Sheffield. We are also joined by Lucy Ettridge, Assistant Director of Health Inequalities and the programme's lead. The programme is 2 years in and a lot of work has gone into it. At the start of the programme, New Local worked with the ICB and the community leaders to lay the groundwork for what was to come, and more recently helped facilitate a consultation exercise to understand what mattered for people's health. This revealed thoughts about how to keep active, access to outdoor space, and the area's cleanliness. Over 1,000 residents were spoken to, and the community's priorities from this consultation became the foundation for rounds of small, medium, and large grants, which have now been awarded across the area. The 4 leaders with us today work alongside Lucy and others at the ICB and other city partners to award these grants and oversee the projects. They also receive core funding to enable them to engage with the programme. But let's get into it, and we're going to start with a round of introductions. So please, could you all introduce yourself, tell us a little bit about what you do, and explain your role in the project. Abdul, I'll start with you.
Thank you. My name is Abdul Shaif. I'm the Chief Executive of Aspiring Communities Together. It's an organisation that works with vulnerable clients living in the inner city area of northeast of Sheffield. We're an organisation that delivers services for the community, which include social cafe, a healthy living centre for women only, a community language school, a food pharmacy, advocacy and support. We're not just here to deliver services. We're here to build trust and give people hope that things can progress and flourish and make sure we can transform lives.
Great, thank you, Abdul.
Yes, I'm Gulnaz Hussain and I'm the Chief Executive of Fir Vale Community Hub. It's a grassroots organisation, primarily working for young people. We were set up because mainstream were unable to provide the services to our community, and we set up an advice and advocacy service. We work in collaboration with the VCF, Sheffield City Council and the NHS to benefit the local community.
Thank you, Gulnaz. Megan, what about yourself?
My name's Megan Ori and I'm the Partnership Manager for an organisation called SOAR Community. SOAR is probably one of the largest voluntary sector organisations in the city. We work across the north and northeast of the city, delivering a range of health and wellbeing services in communities, employment support, welfare advice, one-to-one and group-based work. We, at one point, were the largest social prescribing service in the area. It's shrunk down more recently, but that's still a core way for people to access our services through GP and other health professional referrals. And we do a great deal of community development work as well. So we have a team of community development workers who deliver our small grants programme and capacity building for community groups.
Thank you, Megan. Safia.
I am Sophia Saeed. I'm the founder of Reach Up Youth, also the project manager, and we are an organisation that caters for Black and ethnic minority young people from 14 plus. We have open door policy, of course, and we tackle inequality for the young people, whether they access in education, whether they access in health, whether they access in sports and activities, as well as having a communication and setting up our communication bridges between the authorities and the young people.
And Lucy.
Hi, Hi, I'm Lucy. I work for NHS South Yorkshire, which is the health commissioner in the great city of Sheffield. We've got responsibility for population health and buying health services. For me, it's a privilege to actually lead the North East Model Neighbourhood. I'm the programme director. I'm responsible for bringing people together to make it happen. It's been a particular career highlight for me.
Great, thank you, Lucy. All right, to start us off, can you tell us a bit more about the history of the programme in terms of sort of where the idea came from, why it was needed, and what enabled it to come to life?
Going back a couple of years, the ICB received ring-fenced funding from NHS England for health inequalities. I think we got about 1.6 million. And historically, whenever we've had funding for health inequalities, we've spread it evenly across the city and we've kind of diluted the impact. So it's been small impact on a larger group of people. And we thought, what could we do if we concentrated that resource in a smaller area, hoping for greater impact? Looking at the map of deprivation in the city and health inequalities, the North East is really dark red. The darkest colours, it's got the highest levels of deprivation, it's got the poorest health outcomes, poorest life outcomes, everything sort of associated with poverty. And not only that, it's the density of population in the northeast. There's tens of thousands of people living in some of the poorest parts of the country. And I think if you look at the numbers of people living in deprivation in the northeast, it equals the size of a medium-sized town like Grimsby or Wrexham. So it is pretty huge. So they're the sort of the problems. And we thought with the northeast, positives are they've got brilliant, vibrant voluntary community sector, a lot of really good physical assets, great high streets. We've got an area called Spittal Hill, which is sort of our version of the Golden Mile in Manchester. We've got parks, we've got brilliant voluntary community sector, great hubs. So from that positive asset-based approach, there's a lot to build on. This programme is about creating health, not about service delivery. So the North East, as well as the problems, there's also loads of great things going on and we wanted to build on that. And so we've got this ring fence money, but the ICB have actually protected it because I think in some areas the money's just maybe gone to the bottom line. But we've got a really good executive director that's kept that ring fence for Sheffield, and all that money is going to the North East, a model neighbourhood every year. So we've been fortunate with the national funding, but we've got the senior leadership within the city that have protected it for the North East of Sheffield.
Thanks, Lucy. And I just want to open it up to the four leaders as well. From your point of view, hearing Lucy talk about the population density, the level of deprivation, really paints it from the ICB and the health inequalities perspective. From the third sector and the community perspective, is there anything additional about why you think this programme was needed?
I'm confident that what happened 2 years ago was that the right leadership in the institutions of the state and the right community leaders met together and matched up and were able to deliver together. What was lacking in the past, there wasn't a strong partnership between the NHS and the community. So I think these two leaderships genuinely forged a partnership, not just between them, but between us as community organizations as well. I think when you put that together, it emphasizes the importance of successful delivery, because if you have the partnership and it works, we can reach more people who we would not normally be able to reach. And I think you will see quite a lot of delivery in the next few years.
Just before I bring you in, Abdul, I want to follow up on something that you said. You said that before this, there wasn't a strong partnership between the community and the institution. Why do you think that was?
I think it's due to a number of reasons. I think one is, I would use the word racism, but I think I would use the word inequality. The decision makers just got used to working with certain people and they continued to do that for a long time. So the bureaucracy was faulty. I think there's been a correction there. The second reason is that some people in institutions are just afraid to come to inner city areas, particularly working with BAME communities. I think that has been tackled as well. Lucy, Emma, and other people from the NHS have come out, and we've not eaten you, have we? We've worked well. We've worked well. We've had our disagreements, we've had up and downs, but at the end of the day, they've been brave enough to come into the community and work with the community. And I think fundamentally that's really important. We just need more people to do that.
Gulnaz, you wanted to come in.
Yeah, I just wanted to echo what Abdul said around how people work and give recognition from the experience that Lucy had with our organisations over long COVID. That's when my relationship started building very concretely, should I say, with the NHS, because they're about saving lives and have always been about saving lives, and we were put in a situation to save lives on the streets in our neighbourhoods. Respectable relationship between the grassroots organisations in Sheffield and the NHS. When I met the executive director, that did set me back. I thought, what an extraordinary person, what an extraordinary woman. She's actually speaking to me in a way that I want to be heard and listened. I want to tell her about my communities, what they have been isolated and insular and not being able to express themselves. So my journey on this has been kind of extraordinary. I have to take my hat off to the NHS. They listened to what I said and my feelings about what we could do and make our areas better, make sure people and our communities are involved. They lived with what they said and they came back to us. They gave us the leadership to build a voice. So I think in terms of race equality, in terms of getting frontline services, meeting people who come through your front door, meeting their needs, I think they've done an extraordinary piece of work with us so far. Every journey has its bumps and we've overcome them by talking, by being honest. We've been brought together, we've worked together before, but not the four of us in this way. I believe that there is a lot of respect that has grown between all of us and the people that are leading us in our journey as well. I think with that, I can just say that it's been quite extraordinary and very different.
Thank you, Gulnaz. And yeah, amazing to hear about all of that. We're going to come on to some of the bumps shortly and understand how you overcame those. But Megan, I wanted to get your perspective. We've heard about how this was something new in terms of how the community came together with the NHS and the health system. From your perspective, were community organisations coming together like this before, or is this quite new as well?
I think pre-COVID, there was more coming together of community organisations. During COVID, we lost quite a lot of that, and I think it was quite difficult to bring that back. So this opportunity brought us together at a time when we hadn't been working closely before. SOAR has historically had a relationship with Vale Hub and less so with Reach Up Youth, but it's changed that relationship because I think whereas that relationship was one where the power dynamic was perhaps in the past about SOAR being the larger organisation and having amounts of money that we could commission or grant fund to smaller organisations to extend the reach of services. I think it's changed because it's more of a partnership of equals. While there is still some commissioning and grant funding happening, as leaders, we are sitting around the table as equal partners, so despite the differences in maybe size and scale of our services and organisations. So that's perhaps a different way of us working together.
Great, thank you. So this program came to life. The ICB had the idea to reduce health inequalities through better neighbourhood working, and you as 4 leaders came on board with that. Safia, how did you feel when you found out that you were going to be one of the community leaders?
I was very excited and scared at the same time. I didn't have a staff at that time, so we always had volunteer session workers, stabilized in terms of volunteering, but sitting with people would have got that experience of being a manager of staff and everything like that. It was really big shift for me. It was exciting because it was something we were willing to learn and the support was there.
And what did that support look like for you as one of the smaller organisations in this?
I think communication, conversation, feeling you're safe to ask questions, and whether it's within the group or whether it's individually, having that mentorship was quite good. It is quite hard. I've always been the other side, just fill out an application, get a funding and move on. I've never understood the operation behind it. So it was quite interesting and empowered for me to be able to help people to apply for something I helped to design. And you're never too embarrassed to ask questions like, what does that line mean? And my attention is very short, but Lucy helps us with cookies. So that's another way of bribing people to stay concentrated. I couldn't wait for us just to deliver. But then I've learned a lot of patience. I've learned that things that you need to detail in order for you to protect the idea of it is very important. And I've learned that, you can evidence-based data and evidence-based surveys and how you can bring everybody's voices to life. That I've learned a lot through the progress and the process of it.
Lucy, we heard from Safia about how there was eagerness to get out and start delivering. But I know this program, there was a lot of groundwork to make sure the foundations were solid. And now 2 years in, the delivery is underway. What did that look like?
I think Saf and a few others have talked about actually just there's an eagerness to get on with it, and I think there is tension and difference in working cultures where the NHS and other statutory partners are very slow, we're very hierarchical, we love a meeting, and all these 4 leaders just want to get on with it, which is actually refreshing and has really helped us. But coming back to actually what were the steps, this is a relational model and it's all about us working together, us 5 working together, but with the rest of the statutory sector. We've got the council, the NHS trusts around the table. We've got an NGO around the table. We've worked with other statutory organisations as well, DWP. So we all need to develop trusted relationships, get to know each other, and that takes time. You work at the pace of trust. I underestimated how long that would take at the start. We put, and I wouldn't underestimate anybody listening thinking about doing this, underestimate the impact and the need to do some sense making. So as the NHS, we came in, we've got a broad understanding of kind of what's going on across the city. But when you dive deep into an area, you really need to understand it and understand the complexities, relationships. So we commissioned some sense making, which New Local led for us, desktop research and interviews with lots of people, these community leaders, other community leaders, the public, politicians, just to understand kind of who the key organisations were, also any tensions, past funding, did it work, current funding. One of the things we looked at is Burn Grieve New Deal, which was significant funding under the previous Labour government, and it hasn't had the lasting legacy that was intended. So really detailed work, laying those foundations we could build on it to say, okay, what do we need to do? How do we tread carefully? Who do we bring in? So that was really, really good. And I think one of the things as well is needed to invest in infrastructure and capacity building before we get into delivery. We've invested in sort of coaching, mentoring, any sort of bespoke support the leaders have wanted. We've got a whole plan of capacity building and upskilling for the wider voluntary community sector. Not underestimating what's needed to get people working with us and collaborating. So I think those are the 2 things around sense making and developing the infrastructure. I think things take longer than expected, and I think that they're the 3 things. Focus on relationships, sense making, and investing and supporting infrastructure.
And when you say infrastructure and capacity building, what tangibly did that look like? What did that support look like? Have you got any examples of the kind of things that you as leaders really welcomed and needed, which you got from the ICB?
I can answer that from ACT's point of view. For many years, I was doing this job on a voluntary basis, worrying about how to pay people their salaries, even though I was a volunteer myself. This funding gave me the opportunity to be paid and take on the task of managing. I remember when I was talking to Lucy 2 years ago when we first met, and I was saying to her that from month to month, the only thing that's really bothering me in my mind was how am I going to pay the salaries of the workers that I have at the end of the month, because there was no sustainability funding. And I think it's really important for the NHS to understand that, because people in the NHS will get paid in a month and they won't need to worry about that because they get paid. Yeah, in the voluntary sector, if you're not able to raise the grants to pay people, you can't generate the money. And I think that's the biggest gap. So we always lived on a deficit. For the first time this year, we haven't got a deficit. We've got a little bit of a surplus.
Thank you, Abdul. I just want to open up the question to the other leaders around the capacity development and the support you've received. And if you have any other examples of what that's looked like for your organisations as well.
Is it okay for me to come in? I think for years in my organisation, we invested in the front line rather than the management. So as Abdul stressed, we didn't have funding for our role. So my time is now paid for, which makes you think about your contribution. It makes you think about your responsibility to this project. And a lot of funders don't look at that. They don't look at full cost recovery, sustainability of the actual organisation and freeing up capacity of staff. So the other way around, what NHS had done was to bring in a different way of working and to sustain and capacity build the organisations to then be ready. So it took 2 years to be ready and prepared for what we had ahead of us, which is to try and address the health inequalities. I was able to build my infrastructure around my financial capability, making sure that I'm able to spend time and induct staff and give them time, be able to link it to the outcomes of the surveys and make sure we've done what we've wanted to do with that money, what we feel is needed in line with what the people of our areas had said. And we can also draw in other resources, which we have on the back of that match funding that we've been able to receive from this Is Us programme.
Our experience is similar in that there's a number of services that we deliver at a loss. Our social prescribing link worker services is one example where primary care networks don't pay any management costs. It's about £2,400 per post or something that you get. It's a ridiculously small amount. So it just doesn't cover the costs of employing those staff. So being able to get the sustained funding and use that to fund towards our health services manager is that's a core role within our organisation that wasn't being funded elsewhere. Similarly, we support another organisation called Longley Four Greens, which is in the middle of the Longley estate, one of the neighbourhoods included in the North East model work. When this funding came, that organisation was very much at a crossroads, not having a member of staff and not being able to afford a member of staff to actually run that organisation. So we actually use some of our sustain money to put towards employing a business development manager for that community centre, who then has gone on to successfully apply for a lot of funding to bring into the community centre. So actually just investing in that business development post has had a kind of knock-on effect for that whole community, which has been quite significant.
Megan, as part of this, and we've heard this referenced a couple of times already, there was this big community consultation, more than 1,000 residents spoken to, and that played a really important role in shaping the priorities of the programme, the kind of activities that the programme has since sought to fund. In your role and alongside the other leaders, you worked quite closely with New Local to design and deliver what that engagement looked like. Why do you think it was important to have the community and a community leader and a community organisation involved in that design phase, and what kind of impact do you think that brought to the delivery of it?
I think it was vital because we were the people doing the consultation. We were actually talking to the community. For us to know that we were asking questions we wanted to know the answer to, or that we felt were phrased in a way that people would understand, was really important. Going through the whole process of designing the consultation alongside New Local was an important part of being a leader in the programme. We all feel the frustration in our communities of people being asked questions and consulted with and then feeling like nothing happens with the information or there's no follow-up. So we were really conscious and aware of that and didn't want to repeat those mistakes that have maybe been made in the past. Being involved from the beginning in designing that whole process was really important to us. What was reflected back was a really good deep consultation that was quite far-reaching and was reaching into communities that perhaps traditionally haven't engaged in consultations. I think that's probably in part down to how we designed it alongside New Local. I think we were quite good at asking what matters to you, not what's the matter with you. And I think that shift in questioning is really important part of this programme in terms of how it's received by communities.
NHS point of view, the kind of breadth and the quality of the engagement, the findings we got back was in a different level to what we've had before. And I think it was because of the approach we took. So with your guidance at New Local, the 4 leaders wrote the questions, they designed the survey, they looked at different approaches to get the underserved communities. In terms of some of our communities, one of the most challenging health needs and social needs in the North East is the Roma Slovak community. For the first time, they were overrepresented in NHS engagement. I think we had an overrepresentation of African and Afro-Caribbean communities. So it was, in terms of the reach, it was brilliant. And in terms of the quality of the findings, often in the NHS, when we do engagement or consultation, we think we can preempt the findings that will come back. We asked people what's most important to their health, their family's health and their community's health. They didn't talk about GP services. They didn't talk about waits for hospital services. They didn't talk about they couldn't get a dentist, which was a significant problem, especially in the northeast. But they actually talked about things, well, access to the outdoors, bringing, together neighbours. I was really surprised by the findings that came back. I've been involved in NHS engagement for many years, and I learned a lot through working with these 4 leaders and letting them lead.
And I think that's the most important point that Lucy just made, letting them lead. I think it's really important that, first of all, communities are involved from the very beginning in projects and not as a reaction because an institution wants to spend a bit of money. So therefore, let's bring them in. I think it's really important that we've been involved in this journey for over 2 years with council officers and university officers sometimes. And I just put my head up and say, these people simply don't get the message. They don't understand. It's not because they're not intelligent. They're very intelligent people. It's just that they fail to understand when things come from the bottom to the top, they work. When things are thrown at communities, they don't.
And so with the programme in mind, we've discussed the incredible in-depth community engagement that happens. And off the back of that, there's now been a number of small, medium grants that have gone out to fund different projects. What do those projects look like? Can you give us some examples of the kind of things that have been funded which respond to those concerns that were raised by the residents themselves?
From ACT's point of view, it's given a sustainability. The ability to run an organisation is important because once you dealt with that, it gives you more time to be able to deal with the services. Fundamentally, the services that I feel have been supported by this funding is our gym, which is specifically for women, where we've employed 2 qualified personal trainers to give people support in health, diet, nutritious food, and everything associated with their lifestyle and changing their lifestyles for the better. For example, we've had a number of women that have lost weight and came upstairs to me and said, thank you very much because we've subsidized their support. The personal trainer was given free support as a result of this funding that we're getting. Mental health support is a major area where we almost had nothing before this program. And now we've got a worker who specializes in giving mental health support. Traditionally, mental health support is tabooed in the community. Nobody would talk about it. So on Mondays now, we have a coffee moon where people who are suffering from mental issues are actually talking about it. These are the people who wouldn't have gone to the system to get medical treatment. They've come for social support treatment. Sometimes when you talk to somebody and listen to their problems and resolve a few issues for them, you resolve their mental health issues. It doesn't need tablets and constrained in a hospital. You can actually deal with it in the community. And I think it's opened that up for us. And the last one is our food pharmacy. We've strengthened our food pharmacy by having 12 volunteers with a paid coordinator now. This is nutritious food that we give particularly to refugee families and new arrivals that have come into the UK. With all the dehumanization that is going on, this is a major project that's helping people to really get fed and get integrated into the system, which is what we all should be doing, rather than the nonsense politics of racism.
It was really nice to meet some of the people who had got in the grants, and I think the medium grants itself was to kind of support new and developing groups or groups that would need extra support. And I think bringing all that together, we've got a wide variety of projects that are running right across the Northeast and will continue to do so. The process is vigorous and allows people to apply for grants that will address those outcomes that were said in the survey, the kind of small things that have bigger impact in communities, even if it's a walk and you walk with your neighbour or you bring people together in different ways. I think some opportunities that come in through this grant process are life-changing for some of the people that are extremely isolated or are not part of anything in the city. And I think it's breaking down those barriers. A little bit of money goes very far in communities.
And I'll open this up to the other leaders and Lucy as well. Are there any projects in particular that you know the details of and you're particularly excited about what they might go on to achieve and the kind of activities that they're doing?
I could say something about the allotments project. We're not an allotment project, but we do have a green prescribing worker, connecting that to local community allotments and growing projects. We facilitated the creation of a partnership of community allotments and growing projects. And I think it's really exciting because I think that there's quite a few of them around in the area, but they haven't ever really come together in this way and worked together. The funding has allowed them to invest in development work to enable them to think more collaboratively, and they're already exploring opportunities for further funding that they could apply for as a partnership, looking at ways that they can collaborate, share resources, do joint events, and ultimately open their doors to a wider demographic in the community. They can refer people into each other's services and benefit the community in that way. So I think I'm quite excited to see where that will go. There's not necessarily a role for SOAR in that going forward. That's about us facilitating them to come together and then seeing where it takes them as a partnership. I think that they recognise that as quite small community allotments, they can, when they collaborate, they can have a much stronger voice. And I think that's going to be interesting to see. I can also say something about some of the small grants in the first round, if that's helpful. A lot of the small grants funded in the first round physical activity. So there was things like boxing clubs, yoga for children. It was really varied in terms of the range of physical activities that were funded. And then things like what I might call a social cafe. So that idea of kind of lunch club type of activities, of funding like the room hire in a church hall or a community centre for people to come together on a weekly basis. They might have some food, they might play some board games, they might just have a chat. And so those kinds of activities have been funded through the small grants, which, like Gulnaz says, can be quite a small amount of money that can really go a long way.
That's great. Thank you, Megan. Lucy, what about you? I'm conscious that these sort of community projects look different to what a typical NHS health intervention might look like. Is there any particular projects that stand out to you which you're excited to see run the course of the time?
I couldn't possibly pick a favourite. They're all brilliant. I've started to go out and visit some projects and I just come away, my heart's full, I'm smiling because you can see the impact that it's having on people. So really, I think they're all going to be brilliant and they're all doing different things. Some's about food, some's about growing food, some's about exercise, some's about access to the outdoors. I've seen pictures from Reach Up Youth with young people hanging from zip wires. I mean, some are going canoeing. They are really doing different things and they're targeted to the community. But I think they're having the same impact. They are bringing people together. They're connecting people into the communities, maybe for some of them for the first time. Because I've read some of the stories. I think it was the allotment project, actually, Megan. And people saying they never left the house, even if they're just going to the group one day a week. They're getting out, talking to people, making friends, and it is starting to have a big impact on their lives. So some of this is really purely like primary prevention. And a lot of it is early intervention. Some people probably are ill and it's helping them in their recovery to health. So yeah, I think they're all brilliant. I couldn't pick one.
All right, great. So having talked about the projects now and heard so much about the work that has gone into this program, it must have been very complex and complicated, bringing the 4 community organizations together to be leaders. You've got the multiple rounds of grant awards, all different sizes. You've got collaboration with the NHS and other statutory partners. And I imagine this can't have been easy to negotiate on a day-to-day basis for all of you. So, Safi, as a small organization, I imagine that often in your world, it's kind of like head down, working independently. How has this been for you coming together as 4 leaders? Has it felt different doing this? And what has cropped up for you on this?
Naturally, I'm a very solo person. I don't ask for help around my family or children, let alone, professionally. So I've never partnered with anyone across the screen before. But it's really good to learn about the processes, proposals, panels, conversations, what it means by designing a flyer together, a logo together, a message together. One thing I've learned is language is very important. Yeah, I've considered these 3 to be my mentors, to be honest. At the beginning, to be honest, it was the opposite. It was like, what do they want with me? To be honest, I'm all right, But afterwards, you're like, yeah, you'll be an absolute, doolally if you do not use this opportunity to learn and reshape your thoughts and, grow up. Basically.
Golnaz, what about for you? How did you get to understanding each other's working cultures, getting to know each other more? What did that relationship building look like to you?
I've worked with two of the organisations quite closely for a number of years, directly and indirectly. I wasn't oblivious to what I was walking into, and I've got better at reading the room, understanding where different people are coming from. I have struggled. I'll be completely honest. I've struggled because I've always fought for justice through race equality. I've struggled at times to get some understanding on how different people work around fairness, equality, justice. And so, like, if I feel like there's an injustice balance happening to even the four of them, I've always got to have a say about it. Everyone will know that around this group. I carry a lot of it, but I've kind of like slowly overcoming about it. I can ring Megan up anytime. I can speak to Abdul. I can speak to Safia. I've rang Lucy up sometimes when I felt, I didn't understand that. So it's a really difficult journey for me. Like, I see things through black and white, from experience, from right and wrong. It's been a real journey for me, because the people that Lucy's bringing on the table are really critical and important. And I'm hoping that through that not only do I learn, but they also learn and try to change the way they work. I'm hoping others also learn to understand what we're trying to achieve. We need backing and space, and we need to be able to come together and be heard as a group of people.
Thank you, Golnaz. Lucy, we heard a lot there about the fact that there is different ways of working, there is different perspectives around the table. Could you share a little bit in terms of like how this plays out? Because it's important that everyone does get to have their say. So how have you and the programme created the space to have those conversations?
We have a programme board. It meets once every month and it's a couple of hours. But I think a lot of the conversations happen outside the programme board. So I personally meet with the four leaders once a month and talk through ideas, challenges, reflections. We meet individually. I think New Local have facilitated quite a few events for us. So bringing the four leaders together in the ICB, the four leaders and the rest of the partners. So you facilitated a really good session. I think it was 2 sessions last year, where the focus of the conversation was, what do the community leaders want from the ICB programme team? What do the community leaders want from the statutory partners? And then we did it the other way. So the ICB got an opportunity to talk about what we wanted from the community leaders, statutory partners. And I think it really started to break down some barriers and started to improve relationships. So I think a lot of it is informal, and it's getting to know each other, getting to understand each other. Anybody listening to this will appreciate that, we're all different and we've all got different things to offer and add. And that is really, really complementary. We are sort of different, mix of personalities, different lived experience, working in different organisations, but almost like comes together perfectly sometimes. And like we do have lots of challenges, but that's great. So I think the leaders do push back on me quite a lot and challenge me, and that's what I really appreciate. Don't always get things right, but I think because we've worked on those relationships, they can say, "Oi, Lucy," and bring it back to programme principles of the grassroots communities. Sometimes we can get lost in NHS bureaucracy and slowing things down. Don't underestimate the time that the community leaders give to me and give to the programme. It is a lot, but it is invaluable.
That's amazing. Thank you, Lucy. So we're now 2 years into the programme, and we've heard so much about all of the work that's gone into it, all of the relationship building, the design of the work, all of the projects that are coming out. Megan, if you could reflect back on those 2 years, is there anything that you would have practically done any differently? Is there anything tangible that you can put a pin in and be like, actually, upon reflection, I wish we did that a little bit differently?
I think a key thing would be about getting the governance for the programme right and in place sooner. We had to go through the process of getting it wrong before we got it right, and that was part of the journey. In hindsight, you'd go, maybe if we'd got the board in place a bit sooner and the right people on the board a bit sooner, perhaps some things might have played out differently, and maybe some processes would have been a bit tidier and neater, we'd have maybe had a bit more transparency around some of the decision making early on in the programme. So I think that's probably a key learning point for me. It's just about getting the governance right a bit sooner. At the beginning, we wanted to make sure everyone felt included. So we were having these really big steering group meetings where everybody was turning up from all kinds of different services, all different council departments, and everybody was there because everybody was interested and wanted to be part of it. But there came a point where we had to say, we need to make some decisions, and we can't do that with such a large committee of people who are all bringing their own interests and things that they want to do. So I think we had to strip it down to who are the key people with the right authority and decision making from the right organisations that need to be around the table for the board. If we'd have got there a little bit sooner, things might have progressed a little bit faster.
I'll open that same question up to the group. So being 2 years in, looking back on it, is there any kind of moments where now you might be like, oh, damn, I wish we did that thing a little bit differently? Bearing in mind, we might have people listening that might be about to go through the same process. Any kind of tangible recommendations you could make based on your own reflections?
I think that the NHS, I know it's probably a challenge in the arguments that Megan has just made about we could have done this and that. I think the fact that we didn't do it may have been a good thing because we've got used to working with a system that gives you 5 grand, 10 grand, then monitors you to death. Yeah. Where you feel, I don't want that grant anymore. Yeah. I think this was different. I think the NHS did give us that opportunity to work without all the extra pressures that brings in terms of governance. Governance is very important, but you need to build it through a sustainability program, which we are doing now. Had we been hammered with that from the beginning, I think projects wouldn't have succeeded the way they have. I mean, that's my view. The second thing is that this program wasn't initiated by the NHS, it was initiated by us. And I think it's really important to get that argument straight. I think the meeting that myself and the BMA 5 had, where we met Lucy and spoke to her about what we want, she took the brave decision of working with it. I think she could have laid back and went back to her colleagues and said, no, the bureaucracy is used to working this way for a long time, in which case we'd have had nothing. And the access to NHS services would be much worse. We bridge that gap now. In a sense, where people couldn't see their GP or their specialist, they can come to us and we can facilitate a process for them to have access into the service. So these are some of the issues that we've worked on. ACT is in a much better position now than it was 2 years ago, but I want to see it in an equal footing with these bureaucracies in the future. And I think it can be done.
Lucy, do you agree with Abdul's depiction?
I think Megan as well. I agree about the governance. There were too many people involved at the start and it should have been more focused. But if I could come in, I'd do differently. I'd do more groundwork with the system. By the system, I mean senior managers in the NHS and around the partnership with the other NHS partners, thinking differently and measuring the worth of this investment. It's very high profile. It's one of the 6 big priorities in Sheffield for the Health and Care Partnership. And people are keen to see results quickly. And we know this sort of investment and work takes years to see a real impact, maybe even sort of over a generation. And I don't think I prepared them for that because within a short period, they were asking about what's the impact on A&E and what's the impact on diabetes. So something about working with them on the measurement, because I think if you count the same things, you get the same results. So there's probably maybe getting more of the senior leadership work into communities. So Abdul's point is that a lot of people don't want to go into inner city areas. And I think those that spend time with communities and voluntary sectors, it does change their view, it changes their mindset. And they do think communities first rather than health service first. So there's something about getting them in communities to see, feel, touch what's going on. I think I would do that earlier. I've always been waiting for, let's get into the mass delivery. Let's wait until we've got the evaluation framework. And I think I would have probably done that within the first 6 or 12 months to maintain the interest of the system. If we think in terms of the investments, this is in the spotlight. A lot of people are interested. A lot of people are enthusiastic. A lot of people say it's a lot of money. In reality, our budget in Sheffield is 1.2 billion for health. Percentage-wise, this is about 0.1%. It's tiny. And I think there is a disproportionate amount of interest in actually what difference are you making, where in reality we give hundreds of millions to our trust providers. and don't monitor and measure them in the same way. So there is something about preparing the system and changing the mindset of the system.
Thank you to our guests, Abdul, Gulnaz, Megan, Sophia, and Lucy, for joining. Thank you for listening. I hope today's discussion gave you something to think about. If there's something that you've heard today and you want to know a little bit more about it, about the project or any of our other practice work at New Local, please do reach out to us. You can find our contact details in the notes for this podcast and also on our websites. All right, thank you and goodbye.